We want to. So
because no, Agyekum Francis,
say,
you don't know how. You don't know Agyekum Francis. You don't know patient management. You have to understand. Say patients and etutu ni nine akwa doctor honum. YEBOAH Agyekum is looking for money than your health. I'm telling you point blank.
Sister, first one me ba na groom nti as one tekasa. Sa sika na wakwakoje no fa sika no ko. Fa usika na wakwaje no fa ko. Na nyesa fa usika na waji obi ho.
Enti enne me betre kwan ye fa so enoa organic insusie healthy insusie. Ye frame YEBOAH Agyekum Francis. Message so like video no share video no. Ama onyanso enza kan be abusia menya YEBOAH Agyekum Francis but rather ye bedin komo about issue bi so ekoso e wo social media no so between YEBOAH Agyekum Francis.
YEBOAH Agyekum Francis me ma wa duru ache ntije aduro ndi ntia me fa mamu ne se ye de mamu amo be fra ha nipa adwen sa ye tie video na tie ni ye wan tie asesa hwe video no biem obeti ase because nipa do so so yesa na ma ye nipa bone
So any one lady bi ankofo binum 88 so oye ND or TikTok on sister what is the junior sister na there in fact nkomo no akoye no ho te say back and forth men tell me ho ase medically or hono ma be dey updating Edebro on this particular video.
Not call him out on where he's making mistakes. And Ghana for a bibidro as Africans and Amakano, we love herbal medication because I don't know what they are saying. It took a Ghana needs over 5 milligrams of amlodipine. Now Ghana needs onum galawa
Because this lady as it stands now the issue is so and I'm gonna lose about 10,000 followers or TikToker but they updating Edebro in this particular video be answer I come on if Abrantie Kwadwo so subscribe ya myself so subscribe to this channel no share video no I want answer keep no follow on all social media platforms do you know Abrantie Kwadwo Tebusia so when name YEBOAH Agyekum Francis YEBOAH Agyekum Francis on TikTok akoye one guy recently na obabat and common heat out also egu social media also with regards to health and Tebusia I know there is a guy ultimate fire which is a topic we know afa no tietire to the extent say wasompo sikrampa obete yare na se enwo kwan e ba e na de nam so ma se no healthy living any good living kofo be living very well e ho no ma there was this video cross on me who say one woman be exercise hwihwi na de wo cheche wo say YEBOAH Agyekum Francis and nam so ono so that particular thing e ho no ma bi so ho no ma obi kwa so timi set ya paduane na wo cheche so YEBOAH Agyekum Francis aduane we mini ni se menye ne se na ade bi no kwa so de di agro back to back na ade but we selling komo bi abato so social media no so a enam so Emma lady a friend MJ rock the world. I'll be replying there and now so my YEBOAH Agyekum Francis about Abrantie be komo with regards to this particular issue. But before say be komu krano in every story any positive side, any negative side, this lady in question. And so a lady some time ago, na nkofo bi no attack YEBOAH Agyekum Francis, especially pastors ni bi. Omo attack YEBOAH Agyekum Francis near there this lady eba Abrantie ebe chechem so when YEBOAH and give up. Ono so enyere no ho na de cheche na wo ye ne de sa attacks ne beba ne ade a. She was very positive in it.
Hi guys, I'm doing this video for YEBOAH Francis. YEBOAH Francis, as somebody, I do something similar, if not the same as you. You should not let people break you. You shouldn't take criticism from people that they are not in the health field. The people are, as I saw more commenter about how should be maybe doctors, you know, people who know what you're doing. Are there more and maybe Omega say, okay, who can we one can ye? Those are the people you should take criticism from. But sir, a soft no, nay, ignorant people no. So who can say with you one? You will stop the good thing you are doing for Ghana. I have seen a couple of your videos. You are doing an amazing job. Do not let people who have no insight into what you are doing break you down. Last year, exactly a year ago,
there was a moment na ebinu kwa edin komo social media so HHM YEBOAH Agyekum Francis so a Google guy or a chat GPT or ya chese nko sem de go be can be social media so trying their possible best to tarnish YEBOAH Agyekum Francis edin e wo hono ma. In fact this lady Babonte be encourage guy na ebinu chechem so very good because the MJ rock the world no ono so one lady odi nkomo social media so about apomuden but no de na koye enemu as a oba ne bema ohun kotie ne sa stis no ohun sa nkomo ni bi na tese MJ rock the world nso di e wo TikTok no so na say utimu say uhwe mu krampo din dia in the medication na say in the world of yen chen for about yare ne ade no ono Yeboah Agyekum fans say the same circle mu in fact omo kwan so bo mo homo say that video no kwan po ye na wo cheche say Yeboah Agyekum fans anyere no ho ne ade no oh senior man comment here e ma nneoma so e kama oh honom
Ghana ni guy no ye Francis Yeboah Yeboah Francis me hu say almost say nkrofo say o use Google and or the answer question and I miss na yen cry yet ha cry live nkrofo ba be bisa yen question na ye cry she me I met her all the time and nkrofo be bisa question no cry me answer no cry almost me ye temu me ye temu me ye temu nurse me cry na yet ha say na and ye nim question na nkrofo ne de be ba nkrofo be bisa question na etimi answer no cry almost ye temu na wo a wo ti wo na wo ye video na answer na we post bra. And you haven't come here to Ghana for would you win? The mere fact that you are doing a good job and people are benefiting. There are other people who are they will come for you are a bit shock you. One shock people who comment and let me tell you, people will make one you're careful or people will make you or they will turn you into something that you are not. Sometimes I look at myself, I'm like, how did I even allow myself to be, because I know I have always been this hyper, but people will push you and make you do things that later on you regret. Ghana for, would you win? And comfort to be a positive video, then comfort to be a show as I say, we are Temu. Everyone, all your life say, now Obiaba say, I don't know why people go and ask their questions. I don't know why. This is a Temu net, this is a Google net. We don't even know what the person is going to ask. As from say, why a video no we're posting it there. Or because okay, why a video, why our research, why na why see one there, and why we post it. And they are not there, brown, what the yawa, me money yawa. Na ye te hakra, but na ye nim question and nipa ni baby son. Baby sa yet me you one. And no crowd no promise ye the Temu. I don't know the Temu no there was sunglasses session there. I don't know. Don't give up on them or do not give up on them. Most people will praise you. We always have to look at the the compliment and the likes. If you actually go in the comments, Nadia, comments in a bit break you down. And you always see the evil comment, the one or few evil comments, that is what is gonna attract.
but we sell Yeboah Agyekum fans say a video be to social media no so all din komo about I think say board there and so any watermelon etini ni ade na o tietem say omo wa yare bi some series of yare bi omo so enkoye ni ade or this disclaimer any same be kwan so eton ho ate say before so obey na so meet sa criteria no ansa no wa yare akoya yare say any ade nti no metimi mbie bebre but yentie ne nsem
Yeboah Agyekum Francis me ma wa duru ache ntije aduro ndi nti amemfa mamu ne se ye de mamu amo be fra ha nipa adwen sa ye tie video na tie ni ye wan tie asesa hwe video no biem obeti ase because nipa do so so yesa na ma ye nipa bone enti na wa akoma yare wa ye se o cholesterol e wo soro o pressure ye se e kosoro pa enjai wa duro no nom disclaimer enjai wa duro no because we enuane we fie na me kire o se o ka bom na aboa o ba be pe body ebunu anase kwadu bunu na wape watermelon baako watermelon kokko na ewom no nye na ye de ye obetima die no ba ehu na e green no ene inside na aduane so e green no ene na wabe fa watermelon baako ohoro ho kama wanya ni bunu no twam 9 na yi baako bia ye de body no so ye fa betin baako 9 for 9 days na ye no but before abel sa procedure we check your pressure check your lipid profile yes I say ni nyina agu na tro because 9 days after me person o ma me results na we video they tag me na me repost me na Ghana for hu said ya ye nuan betima say yare ofa body na tie body baako na wafa betim no hohoro ho kama na twa no round eni ni wura ni nyina nsensene ho twa round say ya na fagu bom bo a obetimi akata so ye di nsuo 1 liter nsuo obetima yusu z de meme nom no wanya z so obetimi anya nsuo bi ade aye but people man pa de fa z ni ye na famienu we mienu ebema 1 liter ana pure water mienu say z anya z ta ema 1 liter na wanya nsuo 1 liter no wo de agubo no say wo ye ni 2 o'clock by this time ye de isi ho ama de ache wo de watermelon no a watwitwa atire no say da ma kire no 9 days na bia wo yi baako atwitwa ene body betem baako bunu no ene ni wura na wo horo kama no wo de ata ho ade ache no on an empty stomach saa 1 liter nsuo no na wo benom na ye nyina fa akonom no goma ye nom ne kakra ansa esa wadidi ipatoti wo aduro no ma betima didi along anom waduro we aduane enye we na niema bi wo boode ebunu ne watermelon echi ho no na medi hu nkomo nne boode ebunu ye flavonoids na ye other compounds wo ofa watermelon na ye L-citrulline ewom saa nema we eboa nitric oxide body ni produce nitric oxide na wa onim nitric oxide bia eboa blood vessel dilation, blood circulation, clot dissolving, a whole lot of things. Into issue with the heart, issue with pressure, issue with sugar and all this. It's me man the bafum. Na mum go so na da wadrum so na ho de ye. Na ye nhwe results no. Say boa na akọ na doctor ka say okay baby adu no. Obeyi wa afra do so a obetimi ayi wa afri so. Ohwe a na ma ye kama me ko ba bi nti na na me nti ho no. Na me nua ba KM na ye me ato so say. Nti ukọ no ho a fashion designer won kan ha o ye top. Obetimi ayo atuso ebia na wo de ne ye nna enye de machire wontumi nna osoro ahona ma ye hodwo wonfie no kwa anim asa de ade akata wa adwen so wo di mushroom extract no gu nsuom ye ne seti na wo no ma ne nyina akọ a legacy life choice na de aba Mr Divine wo de ne ye malaria a typhoid related problem damela de munim obi anim damela nti me kan anya asefofo papa na abi mu pa o give back to the society na o tu sa nyare o yase your damela food na asefo nyina ho ba de bia on me kan we no pedamela ni bi ko herbal store ni chemical store bi na ko pedamela ni bi na emwa ke wait mattress be na das ye customize ye da bi royal foam say ye sofa say ye mattress me pacho e ho na ye ton pillow e ho na ye ton wo de na hotel na wa ya wie e boarding house hostel facility brana beton ni do ni e beto so ama wa o mu odru ma me ni mfia kwa ni mu o pese customize mattress ma ss for na ma wie aba fie no ya akrapa o papa de obekọ royal for warehouse na watobi ama free numbers no na onsa ebeka bi obaga na ha me biomedical scientist na me self-taught trichologist media na YEBOAH AGYEKUM
enti ebuso obedi san komo we o social media no so no ana tese nkofo bi no start say omo attack Ghana because initially the enim say attacks bi so akọ YEBOAH AGYEKUM fans so social media no so a ebinom timika say oh ono so onsuan ade na wabon or say nkofo adwuma in fact nsam na koye bebre but this said lady no din kan be boy YEBOAH AGYEKUM fans abaso some time ago na o chetem so onyere no ho on push hard na ade no afede yenim ni aba madam so chetem so oh YEBOAH AGYEKUM fans kwa no de o kan no kre obeso obeku nipa na de se oro kwan so pese o de bagi sika na ade in fact on a TikTok live and come on just a lady no age no abusu ano de but YEBOAH AGYEKUM fans aba guy as see no on social media and also all around there go for be again much confidence and much interest on the content now all you need is a back to back or post video hit na no them because there's a guy or buy and share but they say around 2.4 million our TikTok no so and I just say MJ rock the world that sound come we ebe go so eka ensem about a drone na YEBOAH AGYEKUM fans at the mind no abusia on also the answer we egu from with regards to that
condition for you to see effect on the hypertension no matter how much antihypertensive obefa who kidney issue who kidney failure stage 4 stage 5 now won't call dialysis open we have some hypertension in drawing or blood pressure and go from because the problem is the kidney. Why do if not that then why do people have to go for dialysis? Say hypertension in drawing but they do time in as a hypertension as a result of kidney failure. They have to treat the underlying condition. So you cannot come and say so moja broswa disclaimer. The only disclaimer he threw out there and he said Kwadwo na ye weka. He doesn't know. He does not know because he doesn't practice. He doesn't know say there are so many causes of hypertension. And moja brosrona or use loosely no. There are so many things about me ama wenya moja broso. Enti obia onyem. Obia onyem betimi aye sign intervention ya okay because obia onyem a bia yama na feed the pain still the blood pressure was low or nipa no be dia okay ye benya nkrofo mo ye gullible because of the trust they have in him. They will do it and they will end up killing themselves. You don't know how dangerous what he is doing.
On this radio side effect ni na so ba omo refer mu to if we are ho aha say like konum sa no marry like no munya so a side effect physicians ya omumbu omu ya oma so no muko omo nurses na omumbu omu Ghana no oma ho no ma na emayi beko and say ukodu honum like na wu a omeka say oh for the munya de abai no or higher. Oh, I saw someone. Oh yeah, he said omunya no. Like omunya ni we see. Like ambassador for like primary health care.
I said like health promotion.
Hey.
I actually said like health promotion education because there are people they are gifted with talking and explaining things. And then I say it's a health promotion, but it's one thing that we are health promotion, and it's one thing that you are providing treatment over the internet. It's one thing you are doing health promotion, and you are trying to teach and your man that we are not calling him out on where he's making mistakes. And Ghana for bibidro as Africans and Amakano, we love herbal medication because I don't know what they are saying. It took a Ghana needs over 5 milligrams of amlodipine. Now Ghana needs onum galawa of ebibidro. I bet you galawa of ebibidro over the 5 milligrams of amlodipine because we were born say you're training with herbs. So we always lean towards herbal medicine, which I don't have a problem. But now when you are trying to cause contraindication, you are trying to and we can say synergistic effect. Synergistic effect, it is when let me tell you, when I started doing teachings, Nanache, me started me teachings, bisa Facebook. Maybe 2 LP in school. I have been a nurse for 13 fucking years. That is when I started doing teachings. Me started me teachings. It's been 13 years. Me started me clinical and I started me teachings. And then when did he start teaching? When did he start teaching? And most people love people withdraw. What church or withdraw. People love that. People love that. But when it comes to the field we practice, psychologists, they won't give you medication. If you need medication, they refer you to see psychiatrists. But diagnose and treat. Anything that would me call herbal clinic, na nipa ba kono, or see oma withdraw, or so kidney mu, or ma withdraw, or yeah way. I have Daniela, tell them, you have been following me for way. I know, say you Ecclesia. I have been doing teachings for 13 fucking years. Go back to my Facebook and check my life. 13 years I have been doing teaching. TikTok, remember I had 3 years back. 13 years and I'm teaching on Facebook. Besides Jessica say I ain't found no me. Ask Jessica where she found me, where we became friends. Jessica found me doing teachings on Facebook. 13 fucking years and I'm teaching. 13 years and I'm teaching. But Ghana for you can't crash my mompe. You can't crash my obiba. Oh, madam, Mrs. Takra, Nana Messi, and Crawford say, which idea we not move from home beside with dra. Now, Missy,
Confusion where obitini fie se send me ya can't say for widows you a conference say me no way na me no ma ebesa me yare.
and they don't want to take the
Of
medicine
course,
to
they
begin
don't
with.
want to take the medicine. Then nothing, I got complications.
You are saying, they should take it and do this in addition. Maybe and the doctor's one can't
No, but what is said? Exactly. What if so was CHF, congestive heart failure? Now, catching the song called a liter of water or a potassium sparing you kind of say only a potassium sparing diuretic and all what there's so much that goes into it. A bit causing electrolyte imbalance, a bit causing arrhythmias, a bit causing cardiac arrest.
Yeah.
So you can't just come and it's not like we when you people come here, we're like, nope, go to the hospital. We come in even though as we practice as clinicians and providers, we don't come in here and give medications or prescribe medications unless it's something that is as simple as basic CBB topical. We know it won't cause any harm.
Yeah.
But anything ingesting and now fiber near fiber.
Well, over the counter. Yeah,
over the counter.
Yeah.
But it doesn't go beyond that. So he should be very careful and cautious when he's coming to give all these medical advice and intervention. They need to let him know his scope of practice. Can you pull his scope of practice now for you to know which part you can.
What is his scope of practice? He's a lab scientist.
Say he's a lab scientist. So they identify, they I guess identify microorganism, and they do culture sensitivity, do blood work, type and cross and this and. But me name which department he is, but I know crampo no.
He's
My
not, he doesn't
my
even
cousin is a
like.
lab scientist, and no, you have to be certified in certain areas. And so now, bit me interpret certain you kind of say values, and and also yeah,
He's
another
not
thing.
even a pharmacist scramble no kaka saying at least in Kametia say because pharmacists they have in-depth. So yes, but I'm Ampachokasa.
So we want to. So
Because
yeah,
no,
Ken
Ejoku
Ebeneti to
Francis,
say
you don't know
yeah.
how, you don't know, Ejoku Francis, you don't know patient management. You have to understand. Say patients, ena etutu ni nine, ako doctor honum. Ena doctor aye assessment. Ena assessment in no doctor a prescribing. Bebre owa, muko hu doctor, me kwa ekwa mama drobia. Yes, because the doctor realized that whatever you brought in, no, you don't need medication. Obviously, do you know the body heal itself? I'm a A1C of 7.2. Nakachem say your body is gonna heal it. At that acute phase. Kachem say your body is gonna heal it. When you are diagnosed that you have sepsis, ukoye blood work, or fever. Now say when you have sepsis, Kachem say your body is going to heal the sepsis of the blood now with nyano. So people go to the doctor, and before a Ghana nibeko doctor no na dia na a yeding. Bebre ohonuma before obeko doctor no na a yeding. So when you go to the doctor be your physical assessment, doctor be take you history, physical objective symptoms, subjective symptoms, signs and symptoms, wakwa labs, wire scans, and sana wakam with a diagnosis, and then they treat you. It won't mean come obi assess so. Obi diagnose you no obi emfa want to treatment plan so. Na obi a onim background, onim baseline, onim how you got what, onim she. Ebeka cho say, I am telling you to do this and this is going to help you. I'm telling you to do this and this is going to help you. And you take that advice over the person now. When whom, what feel, why you labs, where review labs. Are you kidding me? So, Ejekun Francis, you don't treat patient. You do not treat patient. So please, and I don't really care what Ghanaians. I don't know please, with all due respect, do not come and corrupt. If you have been corrupted, don't come and corrupt people. Doctor, why am I dry? Almost surviving. People are surviving on their the pain, low the pain, or they are on their legs. People are surviving on their medications. Do not come and corrupt them. Say, oh, yes, me ye way, yeah. Because nipa bebre on ma a drone is sacra no more refilia. Sike ni wo a yedding. Into omunyate say would
It's a was already some common social media no so and YEBOAH AGYEKUM fans say buy you know how. And say oh church so ono there like only problem say be why prescription and that's what can say me na be I will give you critique about it. But on no fella say the way I was seeing sa woman at the end there. There was like a woman so etimi bo piano say oh minua what dim komo we na komo we ABCD e nti na bia say ni madam so anya ne sa ana de say YEBOAH AGYEKUM fans say the same way be man no social media no so
YEBOAH AGYEKUM Francis attack no afa different form na nipa bebre adwen course me be play Mrs. Ahofefo video na wahwe me pato nya abotre na hwe video no pa for your sake na video no hwe wi a me ka asem bi wo video mu a kire ene yenu be ma ba ko so ye video say fufuo e ma kompo goita na me nkyere mo ni nyina na mu hu ba bia attack no afa the video no na ye play yes sister video na mo
so what pressure rosa for wedro na sanye we kan Ejekun Francis, do you know that most people on blood pressure medication are on diuretic? Do you know what diuretic does? Diuretic wastes fluid from your body. It will catch obia ebia who categorizing no one categorizing who generalizing no who say who pressure who emboja brosua for wedro one can say who anti-diuretic. So see, that is the problem because you don't practice, so you don't know. You do not practice, so you don't know. So a pressure dronana, you can go and read about the pathophysiology, but to diagnose and treat, you have to be really. It's crazy. You guys should say talk because Mecca somewhere and you say.
And
Radio.
say there are so many arrhythmias.
Yes,
as
sister,
a one
video
share,
ya
you
here.
taking
Mama money
potassium
tofa.
and
Video no
you
wapa life no okoye. Na sister you will be a mepenasem pa me because of say me medical research in it. Obi a way into the medical field biano. I consume their content. Into me penasem. So what person me who say me penasem a yes sister ba call US and dada Joe ne yere no. Na don't call. Me penasem pa for the back to last born Ezra. Tell me I'm sure more videos. Omo ne kakra mu nyina ne baba boy no. It I hear more videos. Nti I found out say sister we ni nua na ye na donko. Nti ma me be pair sister is wasem. Na sister is kwampo pe ma asem pa o. Pe ma asem pa because recently ko be ye video ana was nkofo say ne oye slim. Ebo mi din na ye bo a me no madonye kese na ye. Na me aka me be comment say she looks so beautiful. Nti mo onfa adro bia mpo enko ka ne nipadua because ne ho ye me fe. I said it. Nti onye obi oye very far away. Me ma wahu we no wahu say bibi kwampo na my video na sister any me nya adwanka obetumi adiem me na nka obisa me consent if I would do a follow-up video to correct some of the things I say kwanka ebeboa na ade ba ko Ghana make atire mo ne say yebo assignment na wade aba no we obi na oba na obe criticize I mean ka say criticize you be pacho nya abotre na hwe ni yie because our sister yi on one videos we ko comment sections all say Ghana for attack you because Oma try so many ways to get YEBOAH down. Yede afa soro, yede afa fom, yede afa asofo, yede afa prophet, yede afa abosomfo so. And I be content creators. So recently, your brother Bakwa Tembia on the comment on bad. The obi ka say good on say bad. Mini say money no. Obeye me hot story be brave man kososo. But me ka say nkofo skip breakfast. Omo person man no pa. Say me nipa en skip breakfast. Man me soso because obi a skip breakfast bia who the benefit a onya na YEBOAH na eka nipa no nya na physically a me nya ho hwe me nya hwe mfrim just to help somebody me pacho no obi da aduro so ti me ka say mo da aduro so ne de breakfast skipping mo nka ho this any pa kon say na odi fufu tunkwa na odi num na dura because what say YEBOAH say skipping breakfast it me botu nyare one ntin ene wate aduane odi na no pa obanu madu no so bebre de aduro no ntin yiba nko anopa ai betimi ama no problem ba nei what in a do any dis no de anom na duro ene ebo o munyina nti ho o me de fa ho so amfa ena na no me se me ko ba bi nti me real quick video no a me kire mu remedy ye ma me mu ne papa mu ene enuro no ne niam na ye nom no e ya adoso enti me hwehwe mu ni me research I don't just come out to talk we Mr. video or making emphasis be say because you don't practice your professors no much ade no most of them they don't practice you by abandoning knowledge and wisdom forget it. You know I'm Ghana for baby wa butira mo practice it but practice no who get in contact do 1%. Doctors are say no mo surgery now mo ya abrofo no kwa no omo ni omo ho bi ho mo nkwa tipenko before they perform a serious surgical process they sit like a board meeting no ma discuss the condition no we can A na we can B na we can C na we can D enti omo to adwen a na omo nyina conclude on one e kire wo say ye omo nyina asua ade ba ko na mo obia wo say de ofa so ti ade ase Mrs. video wo say obi wo ho a or pressure right ena bebre wa akomayare no mo pressure na ebi mu e wo direct so say de be ya fluid omo jam no e be ba fom osan ko boka say me tramadol me say boys no enye nitrate ne tramadol I don't even remember saying that me na me ye Ghana ni am aba be video say tramadol kwa hu sin cocaine me boa me what those videos e oba bia so me amaka sa asem no me dia be kasa obi nkofa tramadol and obi nkofa red and obi nkofa aphrodisiac I'm the one that always speak against and I give local remedies impo to help people so that be omo be jai eno me nka wa de bia say watermelon containing L-citrulline eno so boa nitric oxide the make nitric oxide name say a dilated the corpora na where the tissue na where be man no mamoja oguro no de bia meka enti sister ada na o ma ho kwan so obi na eba ho some the previews so I don't know but the oye no me hu ni say so the achopa e Ghana for because we didn't throw baby to me so in the video e be a tramadol asma me kan I never said that o de ma menchiro wade na tie ase obi wo blood pressure the episode hu ni say ni ntin no a constricted enti ye pese intini no mu bie na moja ntimi di mu afusa ne yi blood pressure ne ntese moja adoso wodi mu ye ntie ne yi enti pressure dodo na ye de mo na e vasodilators eboa e relax blood vessels na are stiff no ma emu ego kakra enti me video na me ye no wo hwa me kan say so obi da duro so a onkoso na onnom na duro no I was so emphatic about that. Uncles na on my drone. Idea metro nyina simple. Me say body. Over body betim. Ye in 9 days. Manka say ye in the whole year. Ye in 9 days. For body betim. Na fa watermelon echi no. Watermelon ba kutwa mu 9. Na echi no. For nsu 1 liter. This is the person tell me say obi wo pressure on num nsu ana. Because I say say dey na me tell e nsu na diuretic minimum dey diuretic eyi nsu free nipam. Nti no. All say num nsu no. Messy one problem. It's because my sister knows the theory, although she practice, but on the area one. See, I see. When you say obi so pressure, and put on so one num nsuo. Say that wakati me say obi num nsuo. So obi so one num nsuo. No, yes, severely dehydrated. The sodium cost. So the sodium level cost that they see. Vasopressin, a release. Hormone now is minimal. Anti-diuretic hormone. A release. That anti-diuretic hormone is something vasopressin. No. A bad they see. A my vessels no air constricted. A some blood pressure and HT. Until we can make sure we say all num nsuo for something. No. Now one moment who says one num nsuo anka we never. Ya munsuo ade ni you. Obi waga na mbu na nimtia so onim hwe. Tu be kasa tieti anaso akọ. Moja na epim nam droben mu. Ye mpese ebetwi wo no kese. Ye betima ma na ntwi kese a se blood volume no ba fom a entwi ni kese. Ana se blood vessel ebie se ya. Te se wo de hose water car. Se hose no muso a entwi nchen kese. Ana se nsuo na eba na se pressure nim kese a entwi nchen kese. E two things. Nti diuretic na ye de manipa no reduce the volume wo moja no. O se moja half ye nsuo. Nti se ye ma nsuo na wo mu bi ba fom a pressure na enam wenum nurse na atwi nchen. That's number 1. And number 2 ya duru no mo de ama na wasen no maka ho a eboa high dilate ama ntini mu abie na moja na san akwa ensan so ntwi nchen. E two things. Na eno no kire se obi wo pressure onum nsuo ana. How much of the water tampon bit me akwa se oni se obi wo pressure one num nsuo glass of water esen ka ide otuminum 8. Ade a me kire me ka se 1 liter. 1 liter any regular glass of water be 250 ml. 250 ml me ni say 500 ml. 4 is 1 liter, 1 liter, right? 1 liter 4 glass 4. Na nipa na also onum 8 enye half. The sample si su dia say many nipa ni nyina fa ako ennom ne goma. Enti onfa ne se ni nsuo. En eye nsuo so na obi life no na Mrs. Abako be Irish kotomiri na o say Ghana de say obi aka brofo say yes woni ma de ene ne ye nde na o say na potassium crampo na what those concoctions no a bit mama obi anya arrhythmias na o te arrhythmias na a bit ma boa na nipa na wu instant. I mean bro body anya no ai potassium do say na be lichi abansuo no body betem crampo mfa say ye no nyina potassium do say na one say doctor bia ka kire obi ho akomayare sem wonum kubensuo woni potassium wo kubensuo enti sa ade na ebe lichi free body na hahan ni mu a ebe ba nsuo no mu nti na me stress on ebe boa blood circulation ebe boa relaxation of the blood vessel no me ka flavonoids organic compounds wo na eno no mpo no nya ne ebe ma nitric oxide na akosuru mpo enzyme na o producing nitric oxide na owo blood vessel blood line ni mu no ye friend no endothelial nitric oxide synthase sa enzyme no na ye be stimulating your activity no na produce more nitric oxide na the production unim say adwene guso regulating the amount of nitric oxide na you producing enko dilate nipa no ko radio blood pressure that the blood vessel na stiff. How much can you the person me ma demonstration obi hu me ma ho de betima pia pillar ye fie pillar me ntimi pia o because pillar na dey hold it down emu ye du esihoye. So the amount of nitric oxide be bin kwa eye na here potassium do doesn't need free body ni ma wura nsuo. From every angle you guys were on the live and you were wrong and you were also insulting, saying all kinds of things about me. I said Mama yes why me po asempa we obi I really watch your videos. I like you. You are a good person. Man yes sir. So bimpo na afa also say mo so mo medical field for am one numbers. Na be kan bibi na loophole mra de yebo e kan ho. Wan hwe ya obenya problem. Because if me ka me say ma ade na me ye no. Wa odo wa no be sisu bia no. Wo betwe problem ama ho. Because de me ye no boadom until some be hu say rasta man bia be tre medical staff say that. Me nyo obi a me ma me kra person mafo abaje say nso say ne ma me fo kra jime to ye boade fo abaje say ne utiri be tre because ye benefit wo de ye wo ye no. me braba kwa na me kam say one dey o se fufuo e ko se go etai dia o se e wo fufuo ewe go trojans na e wo fufuo mu no e wo banche nso for banche a on toxin bi wo banche e friend cyanide na saa cyanide no ye liver no etimi convert cyanide no so the be less harmful na koma e thiocyanate saa thiocyanate no e compete iodine on say goiter compo ade e tade ba pa a lack of iodine na ohwe higher thyroid gland your gland bi wo heart butterfly no obo produce two hormones bi T3 na T4 na eboa metabolism eboa brain develop eboa ne me bebre e won fasodie nti thyroid won fasodie pa na ade ba ko a wo use di ni djuma de friend the iodine no nti na ohwe ya nchene mmo no nchene salt mmo no ye free system no na ye di de egu we mu no me pese mebo brand bi a won sa nchene na ye di because iodine bi wo na sa thiocyanate na one iodine be compete emma didn't mean for enough of the iodine. Once all children say, come on, but my common sense in will say, Kuruma nipa do send the fufu, na nipa do send na o waiter, na o compo. Said the omo can no cry, nipa send o compo. Mami for room the science. The science is that fufu bi enu hwa yeri bayire mu. Yeri bayire banche no banche mu. White trojans na wo kana e wo banche ni mu no. Elichiba nsuo na ya no an fufu ni yegu fufu no ho ansuo ni nyina ekọ banche na da no betim kwa yibia di hwensi. That is number 1. And from hona enye no kre because my be kan fufu asan fufu ya aduan ba kwa Ghana ye. Ohwe me TikTok o ma yisa video no ba because on crofo wo tumi wo TikTok no so. Nti na maka jam say mun ko me YouTube YEBOAH AGYEKUM Francis. Mun ko me Facebook YEBOAH AGYEKUM Francis. Mun ko me Instagram YEBOAH AGYEKUM Francis. Na mun ko Twitter YEBOAH AGYEKUM Francis. Because TikTok no video am de beto obi a ba na de ko. Go on crofo guso e report mun pe no kre. Se banche no ofa wo nanum kura no owe a cyanide na eye poison no liver no be converted to the thiocyanate na eno po na betimi a compete no na eno e compete kura no because nchina yedi na iodine do so ntin etimi overcome no oni se buronyini nya hu se yedi eti se eso ane amada ndi sa buronyini ne ba no be nso obi ton pure water na nso ni sinisi obehwe ni se why are you carrying water on your head so wo ye gane na ati abrochiri wa obeka kire nten mo amwa abrochiri mo nim se buronyini nim se ye mfa akora nche ye chia mutimi di akora hye mo chia na ye hwe mo akora nche wachi obewu ohuni se wo stress akora no ebe kunumpo sa nipa kwa na turo buku a wo sua no ndi sa buku ndi obetiro mu YEBOAH ka tie buronyini ba na me shafuo konkoma ni boy me ebo me nkofie ba ire nkofie obeka say I will destroy my waste YEBOAH you destroy your waste why are you doing this work ba me konkoma ni boy me nim say e kombeti me akumi asensisi yare nti me kobo me nkofie na manya ba ire ndi se me konkoma ni na me mame de me akosu na me ba na me be kire mame mo a ohu me social media so ade me kan say wo nkofie na ba onamu ye na aso na nkotwa wonan tiza wotena aburuchire kase YEBOAH encourage mikrofo se yemo ba ire nkofie na oni se ba ire nkofie se sisi yare oni se ba ire nkofie na wo so nim se wo free Ghana a kom so kuye ni because buroni no onim kom nduka yen se kom timi di obi a obo nkofie no wanya ba ire didi a onjindi because they go to the grocery store to buy food mo yen tinya ma asi o utu kwan a entrese nyansa nyina gu utimo oka brofo a entrese nyansa nyina gu utimo like video na share mo bi
entebu so YEBOAH abedi san komo we gu social media no so no anase videos no start say pop up bi won sanso hu video bi a this same lady no edin komo cheche mu say an YEBOAH AGYEKUM Francis no ono de sika na obepe o social media no so yes ono de je content na wo ye no o de kope sika ene ade ho no in fact and there is a guy YEBOAH AGYEKUM Francis no on ma TikTok live say go for on to gift money da on fa product bi meto wo say go for meto na on fa nya sika da unless say be any hair product which is care clan and call for because no yeah that before say all bed started that kind of education of where you say where you do how you say ni I don't know not turn that I na him say why do Francis on kan so etonton san no man that and no kwa dey every cycle ni but this said lady no him say I senior man ba game nim say on so beton ni o ma ba jiska efin kofo ba statistica efin kofo ho ni ade a utimi say YEBOAH so te no de abufuo e ba reply madam. As all,
YEBOAH AGYEKUM is looking for money than your health. I'm telling you point blank.
Sister, first one, me ba na groom. Nti I say one tekasa. Sa sika na wakwakoje no, fa sika no ko. Fa usika na wakwaje no, fa ko. Na nyesa fa usika na waji obi ho so wo be say YEBOAH no. Wrong money na wakwaje no. Upo obi akase o pisika organa for ho a wo de YEBOAH na be example. Obi amatena kroma a biomedical scientist a mebe baba amiyitri ayitri akere Ghana for over 500 for ade WhatsApp group me de madade akere o made amanji obi a 1 cedi ene nyame kopon ho mayemiye enti miye video Ghana for ti ase a almost so me so member life da with me dini ni pebo me dini na me ba life and crofo eager to give me money. What want about life? Me TikTok na me using a Ghanaian TikTok. Who use foreign TikTok? Who you US into TikTok na onye sika also. Or life a you get money for the coins. What want me about life? O page ya o ti ya na dey try health we no. Sebi na woni me Ghana for agreement na o try kotie na etwe for sika for views. And then nyame de obi aba was sanitize system no. Nti wani bre no wani brade ukuna ya ade papa wani brade ukuna ya ade first one na I thought say bia na wano na apem but inni one man say wani ebre YEBOAH the YEBOAH ye no attention na ye wo so no aba fom kote na etwen Ghana fo ani ate nti wo man attention bi obi ehwe na didie ye nipa wa ma osika moni magu ase moni mo contractors moni na moni magu ase ukuna ya ade pa so ogusu no wote na Ghana for beti maku ahye wani me ka kire wonne I'm serious Ghana for beti maku ahye wani me niema me ton a eni na menya kakra no besi nne eno na megusu ton hwehwe mirror kuma se ne nkran me me video bia me ka se me niema me ton eno na megusu ton nne me ni heba hospital ade bia ni wa ma kire obi a me so onfa sika mbre me na me nyema no oh Ghana for nne ye ni ate nipa nim omo ka asema yeti odi obedwen se omo nim de wo ka omo so o page ni so kwampo omo fanfuli mi na me ka kire omo nim se de wo ka fa boy no hono enye no kre na obi anyame ama no so no nyame ne nsa so sen wo obi anyame ama no so no o try a bafo
ntabuso we ne nkomo so a YEBOAH AGYEKUM fan se de begu so edema MJ rock the world na ade ase sia na de social media so kofo binum bash MJ rock the world back to back announcement madam so lose close to 10,000 followers and so our TikTok na ade in fact nsem no akoye bebre honestly speaking there I feel MJ rock the world looking at how YEBOAH him say on also every content follow no near because of necessary star ND and no any concern go to that extent and say on also can't same way about the guy but although you can also bring in your opinion say be oh ade we now okay me I say ni say which match in the back door don't need this anchor because TikTok there the moment I obey DM will be any panel or numbers account or the attention be man be anko be so how any panel but when you go all out saying stuff about the panel wa bra wangasa woni importe say ni panel so ma bonten so obedi careful be ho ne ade I feel the guy will be angry because this guy guy I hardly see so about bonten so obe reply will be so obi e de no nkomo bi oba reply but to say we no attaching one call and also and I'm somebody I'm gonna be this particular video to social media say busia mess also be share wadwen or comment section no follow on all social media platforms say do you know Abrantie Kwadwo o wie nso wa no share video no ama nyansa keme from Abrantie Kwadwo abusia Macau catch you in my next video bye bye.